Hi, this is Dr. Sarfaraz Baig, and I bring greetings from Digestive Surgery Clinic. Title this presentation is Sarfaraz Baig 2.0 because I used to believe that my mission was to make a career, but of late I think the real mission is to make a difference. Now, where are the areas in GI surgery that I want to make a difference? And I would say that the areas that we are now focusing on are stones, hernias, obesity, colorectal, heartburn, and reflux. And in these areas, what are we doing differently? Let me take you through each one of them. Now, this is the commonest problem in West Bengal, that's the gallstones. And if you look at the picture on the left, you find the three scars, and the fourth scar is in the umbilicus. So that's how the scars look like when somebody undergoes a surgery or for gallstone. However, when you look at the middle picture, you find a much cleaner abdomen and no scars. How is this possible? This was possible because it was done with a robot, and the robotic arms were used just above the pubic crease so that they become hidden under garments. So for patients who are discerning and they want scarless surgery, this is a great method of doing gallstone surgery. Also, it is not uncommon to see common bile duct stones which have not come out in ERCP, frequently even liver stones because of recurrent pyogenic cholangitis, and pancreatic stones because of tropical pancreatitis, again not uncommon in our country. These diseases require either drainage or resections, and many of them are done by laparoscopic method in our center. Hernias have become completely different from what they were used to be in terms of treatment. And nowadays, the focus is on trying to get the mesh in an extraperitoneal plane. There are many procedures that have come in the last decade and have become popular in managing complex cases, such as TAR, peritoneal flap, fascial traction, the use of botulinum toxin, and robotics. And we are proud to say that we are the only center in India probably to have the entire expertise and technology to deal with either simple or complex hernias. Now, this is the book that I have written, and this is a very, very widely read book worldwide on the newer concepts and procedures in hernia surgery. And if you type our name and hernia together in the PubMed, you find that we have contributed in 59 published literature. Moving on to another case, just to exemplify how we manage in a multidisciplinary manner a complex hernia. This is a complex hernia in a patient who's got severe obesity, and this patient has had recurrent hernias. Now, the first thing that we do in these patients is optimize them before taking them for surgery. And this is done in terms of a bariatric surgery called sleeve gastrectomy, following which this patient lost a lot of weight and the hernia becomes more doable. Then the botulinum toxin is used in the flanks so as to relax the trilaminar abdominal muscles, after which the open abdominal wall reconstruction surgery is done in the form of combination of TAR and peritoneal flap. And this is how the patient looks like. So the patient who looked like undoable in the first instance becomes like this and has a much better quality of life. Moving on to our obesity clinic, the difference that we have made is that no more is obesity clinic unidisciplinary. It is multidisciplinary. The patient is seen by the dietitian, counselor, physical trainer, metabolic physician, bariatric surgeon, and plastic surgeon all at once. And a joint recommendation is made. The first-line treatment in form of diet, training, and behavioral therapy is started. And in patients who require adjuncts like medical, endoscopic, and laparoscopic surgery, it is discussed if the results of the front line are suboptimal. Now, we realize that much of these programs do not work because there is no 24/7 surveillance, and therefore we devised our very unique WhatsApp online program. This is our team which manages obesity in a multidisciplinary manner. And we do frequent support group meetings in an outdoor setting. And this is one of the pictures taken in such a meeting. We published recently a treatment algorithm for patients with obesity in India. This was a joint consensus by both Endocrine Society of India and Obesity Surgeon Society of India. I spearheaded with my colleagues this research consensus, and we came to a conclusion that there is a role for both medical and surgical adjuncts. So the GLP-1 analogs, which have made a huge name in recently, and even surgery, which has been around for more than 3 decades now, these are to be used in this particular manner, where the stage decides which adjunct to use. So in earlier stages, we can use medication. In the later stages, we use surgery. And in between, one should have a shared decision. Also, one should factor in the severity of obesity, urgency of obesity treatment, what is the payer status, and what is the healthcare access of these patients. Hardware and reflux, we are the only center in East India to have the entire expertise and technology. Patient walks in this one-stop clinic, gets evaluated by endoscopy, pH study, esophageal manometry, and sometimes food allergy, and gets a protocolized management. When most patients will get medical treatment and some patients will get surgery, and even that surgical procedure is decided based on a protocol. So whether they get a Nissen fundoplication, Tupe fundoplication, or gastric bypass is decided based on the findings. The colorectal clinic, again, is a very personalized services that we give to the patients. It's a one-stop clinic, and we know that the patients coming with bleeding per rectum, constipation, incontinence, rectal prolapses, and obstructions, these patients require complete evaluation. And so it's very important to have everything under one roof. So we have colonoscopy, anorectal manometry, all that can be done under the same roof. We also have ancillary support system like stoma nurse, biofeedback training, and this really helps the patient a lot in getting management. Finally, we do MIS surgery for most of the diseases in the colorectum, thereby giving them comfort, painlessness, and wound-free treatments. We have also incorporated ICG, or endocytoin green injections in guiding surgery, and this has come up in a big way for cancer therapy and resections of colon, and we have contributed a lot in this research as well. Where is this? Where are these given? It's given on 7B Short Street, Calcutta 17. This is off Park Street, and the name of the clinic is Digestive Surgery Clinic. My wife and director, Dr. Sarfaraz Baig, takes care of all the services and administrative work in this area, apart from providing clinical care. For those of you who know her, know that she's friendly and very able, and she can make things very congenial. We have plenty of services at the clinic, starting from having specialists like gastrosurgeon, gastroenterologist, hepatologist, metabolic physician, nutritionist, psychologist, physical trainer, stoma nurse, and biofeedback trainer as specialists. But we also have services like endoscopy, colonoscopy, pH metry, esophageal manometry, anorectal manometry, fibroscan, food allergy test, blood works, and even a digestive pharmacy. So plenty of things available under just one roof. Not only that, we do all our endoscopy and colonoscopy under propofol with the help of the anesthetist, making these uncomfortable procedures very comfortable, and patients who require serial endoscopy and colonoscopy have enormous benefit that they don't get scared of getting it done the second or the third time. One of the new frontiers in digestive surgery clinic, I think, is absolutely the robotics that we have started in CMRI, where we have access to the robot and we do plenty of robotic hernia surgery, particularly at colorectal surgery, with the help of the robot. Finally, I ask you a question. Do I make you proud? Well, just to share a few things, I'm the President-elect of Hernia Society of India. I'll be taking office from next year. Treasurer for our Indian Association of GI Endosurgeons, the second largest body for laparoscopic surgeons in the world. I'm also the chairman of the Obesity Surgeon Society of India Integrated Health. I'm the section editor for the Journal of Hernia, which is the biggest and most important journal for hernia and AWR services. And I'm also the convener for Asia Pacific Hernia Society guidelines. I've had published more than 50 articles in the international peer-reviewed journals. I have written a book which is published which is an international book on current concepts on hernia, and it's very widely read globally. And there's another international book on bariatric surgery that I have published. Now, I have been operating all across India as well as some parts of the world where we do live operative demonstrations of the procedures that we have championed. And as far as what kind of cases are we accepting, plenty of people may not know, but then we have provisions for accepting all kinds of insurance packages, including GIPSA packages and even health schemes and Ayushman Bharats. So we have provisions for accepting all kinds of payer status. What have I got for you? What am I promising you? I'm promising you patient care, one congenial place, good communication with the doctors and the patients and their families, and a fantastic teamwork. And speaking of teamwork, this is the fantastic team that we have in our center. Each one of them are committed, sincere, and we try to do our best. What am I asking you for? I'm asking you to trust us with your patients and trust us for doing our best for the patient. So with that, I thank you very much for your attention, and I hope that we can partner together for patient management. Thank you.